All right, first I got to take care of a myth, because we talk about this shift, and that's what I've been asked to talk to you about, and I think it's important to realize that when we develop a value-based care, I don't sit at a boardroom with people like Negan from The Walking Dead, or Lord Voldemort, or Darth Vader, to come up with this plan of shifting. It really means that in the marketplace, this particular model is approaching 15% of the market. And at that point, the system starts to shift around it because it's a new business model that approaches profitability. So as Marco and Ralph said, there's a lot of pushes and pulls. Finance and policy are the two big markers, and you have to admit that no matter who is president, this is what lays in front of them. So the problem is the same, and there's not an infinite number of solutions. At the end of the day, you have to ask yourself, are you okay with the current system? Because that's what it looks like. So are you okay with that? Some will be. One thing I always tell my staff is all things are off the table when somebody perceives the ability or that you're going to interfere with the ability to take care of themselves or their family. And so if there's not a pathway and there's not a transition, it does make those things a little difficult. We are shifting. This is from Health Affairs. This shows you the 3 eras of healthcare in the United States. Always remember we are a free market, capitalistic healthcare system, and we always will be. I do not see that changing. And really what this says is that we're switching from an area of maintaining disease and stabilizing disease to health. And it's consumer-driven, either from the government, who's one of the biggest payers, or from employers, who are the biggest payers. If you think the ADA is not on board and you weren't paying attention, this is the ADA's Choosing Wisely statements. Came out with the American Academy of Family Physicians and Consumer Reports. And I think if you read, although subtle, if you read, you will see the ADA is starting to also shift. This is from Don Berwick. 2 things I want you to take from this. This is Don Berwick. He's the guy who came up with the triple aim. He's over the Institute for Healthcare Improvement. And he says we're going to switch from a fragmented payment system to a unified budget. And more importantly, from what is the matter with you to what matters to you. And it looks like this. They came up with the triple aim. This is our approach to try to navigate these new systems. We'll improve patient outcomes. We want to reduce cost. And we want to improve the experience of care for both provider and patient. So what would this system look like? What does this look like? So right now, this is a typical Medicaid program, just averages, not a whole lot of science, just for comparison. And so there's 3 approaches, and I've stuck with caries. I didn't want to get into periodontal disease, so this is all related to cavities, decay, kids, really. In a new system, you approach early childhood caries, which is very expensive, with improving the oral microbiome. Good bacteria, keep it. Bad bacteria, get rid of it. The other expensive place are molars. These are fascinating organs. They're living, breathing tissue that cuts and allows us to taste. But that design is susceptible to caries, so we put sealants on. And last, we use fluoride application to help remineralize a lot of the anterior teeth. The current system does not address behavior. There's Ralph, if he's still here, 2 hours that we would spend with a patient, that leaves 8,000 and some odd hours that we're not. And so the current system only works within that 10%. The value-based system works more within that 40% of behavior. So here's how caries progress. It looks like this. This should look familiar to everybody. You have elevated risk. We have an environmental change, causes caries, goes to early stage reversible, although we tend not to reverse in the current system. We have late stage reversible, and then the re-stage, which didn't come up. That's the annuity stage that you can't see. With big data, we now realize that if you put restoration in a tooth, chances are the tooth will be extracted within 20 years, 25 years. In the meantime, a crown, root canal, extraction went into those. If you want to talk about how it looks, the medical model of care is over here. Surgical model of care is here. What we do not have in dentistry is a secondary interventionist that they do in medicine. Right, I have high blood pressure. The primary care provider doesn't send me to have heart bypass. They send me to a cardiologist to have a secondary intervention. We don't have that. We skip past that. We watch. We actually watch disease happen. What could this look like? Here's the two systems really teased up. Fee-for-service pushes everything from left to right. Medicine has been doing this forever, led to those high costs and poor outcomes. That's tertiary care driven, right? I'm going to the hospital, they've invested a lot in the operating room, they make their money there. Same thing in dentistry. So we push from left to right. Under a global payment or a value-based system, we're actually pushing more towards the left. Lower FTE costs for primary and secondary intervention, leaving surgery to the most expensive personnel here. Does it work? Yeah. So this is an example. It's out of Massachusetts. What you see in blue are private practitioners in a commercial plan. What you see in red is an oral health center that implemented disease management and a value-based system. If you look at type 1 on the right, that's diagnostics. Those have gone up over the 5 years. Type 2, that's actually doing something on the tooth surgery. Those decreased. This organization cannot make money in the current system. But they want to continue because the providers are happy because they're providing health, not stabilizing disease. And so this business model works in value-based care. So this business model is going to focus on that and get paid that way. I'll leave you with a couple of things. In this month's Jada, if you haven't read it, you probably should, great editorial in there. Great writer, and what he talks about is the fact that we're having such a problem because the system is moving swifter than evolutionary pace. We have never been having to move so quick in dentistry as we are now. We're used to being pulled, and now we're being pushed. And a lot of people don't like that.